Good evening, everybody. Let's continue with keratin. Keratin, as we mentioned, it is the protein that is found only on the epidermis, the upper layer of the skin. It is tough protein. It absorbs water. It has a waterproofing property. It prevents water loss from your deeper tissue, and it makes up your nail and hair. It has the property of absorb water. So when you swell or when you soak, when you soak your feet or your palm on a tub, the keratin will swell, and you'll see that your skin is wrinkled. Why it is wrinkled? Because the stratum corneum, as you remember, it makes up of alternating keratin and lipids. The keratin will swell, but the lipids will not swell. That's why you see wrinkling area on the thickest skin, which is found in the palms and the sock. If this happens, try to put lotion right away to keep the water in the epidermis layer. You'll not lose water from the deeper layer of the skin. The secret ingredients of all moisturizer is water. They work superficially on your skin and keeps your skin moist. Now we'll talk about the condition of the epidermis. The first condition is callus. Callus, or there's another word for callus, is corn. Corn means in Arabic is مسمار اللحم. This is R. When this happens, when you rub the area frequently, it will stimulate cell division. And the treatment of this condition is using salicylic acid in high concentration. Salicylic acid acts as a keratolytic. So the area that has high amount of cells will be removed. And when you use salicylic acid, be careful to protect the normal skin by putting Vaseline around the corn or the callus. The second condition, termed blister or vesicle, if it's small. When this happens when you rub the skin too hard. Corn, frequently rubbing, but if you rub the skin too hard, the stratum basal, the deepest layer of the epidermis, will tear away from the basement membrane, and this will cause like a gap here, and this gap will be filled with fluid. This condition termed blister. Now when this happens, the epidermis will die. As we said before, the epidermis take its nutrition from the dermis. Now it is far away from nutrients, that's why it will die. And then the top of this blister will dry up. If the diameter is too large, 5 millimeters, then this blister will turn bulle. This is a vesicle or blister, but if it is too large, it will turn bulle. Now, as you can see, it is painful. The bulle is painful because it's too large. So what you should do, you have to bring a pin and the booze, wipe it with alcohol and puncture here at the edge of the bulle, and then press the fluid toward the hole. Then do not remove this flap tender skin, and then apply antibiotic, topical antibiotic, or just use bandage to protect the area. If this bulle happen at people with low immunity, like those that have diabetes or HIV or cancer, do not do this treatment, because Blisters and bullae heals on their own. We don't need to do anything with them. Skins heals if you have damage on the epidermis, it will be healed on its own. But the metabolic rate is very low. It does not have a high metabolic rate. When the scars happen, when scars happen, if the damage happened to the dermis, if it happens to the dermis, then the dermis will form other type of collagen, not normal collagen, and this will make scars. Of course, scar is more difficult to be treated. What we should do if we have scars, if it is a fresh scar, just use silicone sheet to flatten the scar, or you can use laser and filler. Most of the time, the dermatologists use steroid injection or something called cryotherapy. Cryotherapy is a freezing therapy using liquid nitrogen. If the damage is too much and large area, you can do skin grafting or excision. For acne scar, the best is to use cortisone and laser and filler. Remember that the epidermis does not have a blood supply, and the fibroblast, we will talk about it when we talk about the cells of the dermis. The fibroblast is a cell that produces collagen and elastin, and they make collagen and they repair wound if the wound occur in the dermis. But if it is in the epidermis, as we said before, the epidermis by its own, it will continue differentiate from the basal cell to the upper layers of the epidermis to reach the stratum corneum. So the skin is capable of repairing itself because they have what's called stem cells. What is stem cells? These cells are undifferentiated cells that can differentiate into specialized cells and can divide through mitosis to produce more stem cells. The last conditions of the epidermis, skin cancer. The most dangerous of these cancer cells is melanoma. Melanoma, very dangerous, and it is fatal. How you can tell that the person have melanoma? If there's a change in the shape and the color of an existing mole. What is a mole? Mole, M-O-L-E, is in Arabic is shame. If there's a change in this shame in the mole shape and its color, then ask the patient to go to dermatology to see if it's melanoma or not. Basal cell carcinoma, not dangerous. What you'll see are like shiny nodules. It's like a pearl. Pearl means like لؤلؤة, شكل الحبة لؤلؤي. It is round and oval and translucent. The major cancer cells is squamous cell carcinoma. You'll see a small nodules, and then when it enlarge, the center of this nodule become necrotic and ulcerated. This is the end of the second lecture, and then I'll talk about the dermis in the